Your doctor orders lab tests. You get your blood drawn. A day or two later, you see your results. But what do these numbers actually mean? And should you be worried? If you've ever looked at your lab results and felt confused, this video is for you. Hi, I'm Fairchild. I'm a registered nurse. In this video, I'm going to explain the most common blood tests that doctors order all the time. No medical jargon, no scary numbers, just simple explanations so you know what you're looking at. Disclaimer, this video is for general education only. It's meant to help you understand lab results at a basic level. Even with this information, always talk with your doctor or healthcare provider about your lab results. Let's walk through the most common ones. Lab number 1, CBC. One of the most common blood tests is called a CBC. CBC stands for Complete Blood Count. This test looks at your blood. It checks things like how many red blood cells you have, how many white blood cells you have, and how well your blood carries oxygen. Doctors order a CBC to get a big picture of what's going on in your body. It can give clues about infection, anemia, or inflammation. This is a very common test, and it's common for a CBC to be checked more than once so doctors can look for changes over time. Lab number 2, BMP and CMP. The most basic thing to know about these two tests is that they're very similar. You'll usually get one or the other. A BMP stands for Basic Metabolic Panel. A CMP stands for Complete Metabolic Panel. These tests look at things like your kidneys, your liver, your blood sugar, and your body's fluid balance. Think of these tests as a body systems check. They help providers see how well your organs are working together. Lab number 3, electrolytes. Inside the BMP and CMP tests are electrolytes. Electrolytes can also be checked with their own blood test. Electrolytes help your body move muscles, control nerves, and keep fluids balanced. Common electrolytes include sodium and potassium. When electrolytes are off, people may feel tired, weak, dizzy, or just not right. Doctors watch electrolytes closely, especially if you're sick or dehydrated or taking certain medications. Lab number 4, blood sugar. Another common test checks your blood sugar. This shows how much sugar is in your blood at that moment. Sometimes doctors also check something called an A1C test. The A1C looks at your average blood sugar over the past 3 months. These tests help screen for diabetes. They also help providers see how well your blood sugar is being controlled over time. Here's something really important to know. Doctors don't just focus on just one number. They look at patterns, trends over time, your symptoms, and the whole picture. One slightly abnormal lab does not always mean something is wrong. That's why follow-up with your doctor or provider after you get your lab results is so important. Seeing lab results online can feel confusing and stressful. But remember, labs are only one piece of information. How you feel matters, and your provider is there to help explain what it means. If this video helped you understand your blood work a little bit better, please like and subscribe. And if you want part 2, where I go deeper into specific labs, leave a comment and let me know. Thanks for watching, and as always, just ask a nurse.